Hi, so we're doing the nervous system,
Sorry if it's a bit dodgy. We couldn't connect it to the TV.
but this is our presentation. This is us compromising.
And we'll link it in the assignment. Yeah.
Yeah. Cool. So we did the nervous system. So what is the nervous system? Sorry. The nervous system is a complex system that is responsible for regulating and coordinating body activities. So it is composed of the brain, spinal cord, sensory organs, and all nerves that connect all these organs with the rest of the body. It's important to note also that the nervous system is made up of two divisions, which is the central nervous system and the peripheral nervous system. So, more info. So the diseases and disorders. So some of the diseases of the nervous system include vascular disorders. Examples of this include stroke, subdural hemorrhage, and hematoma. Infections. Examples are meningitis. Structural disorders, functional disorders, and degeneration, which could be Parkinson's disease, multiple sclerosis, and Alzheimer's disease. So the disorder that we chose is multiple sclerosis. Sorry if I say it a bit weirdly. But multiple sclerosis is a disorder, it's a degeneration disease, which refers to the process of deteriorating. So it is a chronic disease that affects the central nervous system. The cause of the disease is not known. However, it is believed that MS is triggered by a combination of factors, including the body's immune system, environmental factors, genetics, infections, and like for example viruses. So with the patient who is experiencing MS, their immune system pretty much attacks the myelin, which is a fatty substance that covers and protects the nerve fibers. This in turn causes communication problems between the brain and the rest of the body as a protective sheath is destroyed. So it is important to note that eventually the disease can unfortunately cause permanent damage can cause permanent damage of the nerves. So signs and symptoms. There are many signs and symptoms of multiple sclerosis, except it is important to note that this may vary from person to person and will depend on the type of nerve damage made. Some symptoms include tingliness, numbness, sensations of tightness, urinary incontinence if nerve fibers of the bladder are infected, lack of coordination or imbalance, slurred speech, fatigue, and changes in muscle functions. So risk factors that are controllable/uncontrollable. So there are various factors that increase the risk of developing MS. Controllable risk factors include infections. So this can be controlled by preventing infection, which can be by practicing good oral health hygiene, getting vaccinated to avoid disease, covering mouth and noses when sneezing, and just preventing the spread of infections, etc. And vitamin D. So this can be controlled by spending time in the sunlight, eating more eggs, or consuming fatty fish, e.g. tuna. Smoking is another controllable risk, and this can just be controlled by simply not smoking, which I know is hard. And diet. This can also be controlled by eating an adequate amount of nutritional foods and liquids. So uncontrollable risk factors are age, family history, and the climate of the environment that you're situated in. Yes.
And then, The pathophysiology of multiple sclerosis is a demyelinating disease of the central nervous system, which means that the immune system attacks the myelin, which is a fatty substance that covers and protects the nerve fibers. This leads to the activated immune cells targeting the central nervous system, causing tissue damage and inflammation. The nursing management is that treatment and management for multiple sclerosis focuses on slowing the progression of the disease and managing the symptoms that comes with the disease, as the disease is incurable. Treatments and managements include treatments that prevent more MS attacks, such as corticosteroids. This involves the liquid portion part of the blood is separated from the blood. These blood cells are then combined with the protein solution and put back in the body. Another treatment to modify the progression includes beta-interferons. This is an injection that helps decrease the frequency and severity of relapses. A case study that we found was a girl named Danielle. She was diagnosed with MS when she was a senior in high school in 2004. Her treatment started right away with injections. This led her to feel severe pain throughout her body as well as side effects such as night sweats and chills. Danielle said, "I didn't want to be treated different or with any special treatment. I wanted to be treated like everyone else." Danielle felt lost, and whilst going through treatment, she was still trying to figure out what was going on with her body. Danielle didn't show any outward symptoms, but because of her condition, she felt like her life was now limited. Danielle says that you shouldn't let it hold you back because you can do whatever you can still. She expresses that your mindset is what holds you back the disease.
So yeah, that is our presentation on the nervous system. Sorry, you couldn't really see it, but we'll be sure to link it. But yeah, so we pretty much did MS, and I hope you learned something. Thank you.
Hey.